The COVID-19 pandemic has brought the world to a crippling halt. Nations around the world have imposed lockdowns in a bid to flatten the curve and bring the number of infections under control. But according to a recent study published in the United States, the COVID-19 pandemic could last for at least the next 2 years. For the infections to be brought under control, researchers predict that at least 2/3 of the world population will have to develop herd immunity against it. The biggest challenge in controlling COVID-19 is that over 80% of the people who are infected are either asymptomatic or exhibit only mild symptoms. This makes COVID-19 harder to control than influenza, which has been the cause of most pandemics in recent history. Billions of people around the world have been put under varying degrees of lockdowns, and some nations which have managed to flatten the curve and are witnessing fewer infections have cautiously begun to allow some businesses and public spaces to reopen. According to researchers, the COVID-19 infections may continue in waves even beyond 2022. The study has been published by the Center for Infectious Disease Research and Policy called CIDRAP at the University of Minnesota. The study warns that governments around the world should stop telling people that the pandemic will end soon. Instead, they should prepare citizens for the long haul. The COVID-19 pandemic could progress in 3 possible scenarios. The first scenario, the first wave of COVID-19 infections will be followed by a series of smaller waves that occur through the summer, fall and into the winter season. These smaller waves of COVID-19 infections could continue deep into 2021 before they are brought under control. In the second scenario, the first wave of COVID-19 infections could be followed by a much larger wave of infections in the winter later this year, with smaller waves of infections in 2021. This scenario will require the governments to clamp down on the spread of infections with a second round of large-scale lockdowns in order to prevent the healthcare systems from getting overwhelmed once again. The Spanish flu of 1918 followed this pattern. The third scenario has been described as the slow burn. This is the situation where the number of infections and deaths continues at a slower rate. The second scenario is the worst-case scenario, which governments need to plan for. Although the development of an effective vaccine will go a long way in altering the course of the pandemic, but that is to be seen yet.